Okay, everyone, so welcome to the CMS In Touch webinar series. We'll be beginning in a couple of minutes, but you should find that the chat function is open, and if you want to say anything, sorry, that's my son just come in now, so just wait 2 seconds. If you want to say who you are and where you're dialing in from, that would be absolutely fantastic. Thanks. Okay, so nice to see everyone introducing themselves. Welcome to the another CMS In Touch webinar series. And we're just going to, in a moment, be passing over to the organizer, David Jacob from Morgan State University. So what I'd ask you to do is just, those of you that have joined us, just keep on introducing yourselves through chat, but we will be closing down the chat when we start the presentations. And any questions that you have, make sure that you just add them into the Q&A, and you'll also see that there is a hashtag PGS 2020, and also you can use the @CMS _ AOM as well. So what I'm going to do now is I'm just going to, hopefully you won't have to see my face anymore, and I'm going to just pass over to David, who's going to be the organizer for today's seminar. Thanks, David. I'll just ask you to unmute.
Thank you very much, Kat. It's really great to be here, to be in this initiative. It's a great thing for CMS to be doing while we're in so many places around the world feeling lonely. So I think it's very positive, and I've had a great experience working with the CMS team and with the other members of the panel, Sean, Stephen, and Priya. It's been a great experience, so welcome to all of you. I assume you'll be saying hi from the chat, and we'll have questions, one question after each presentation, and then a session of questions at the end. So I think we can move to the first slide, Kat. Screen sharing. Kat? Oh, here we go. Okay, here we have a picture of a very famous woman, Fannie Lou Hamer, from Mississippi, who represented the Mississippi Freedom Democratic Party. And I think that she's kind of a symbol of what we'll be considering in terms of the response of the states to the pandemic crisis. Next slide, please. the kind of perspective I have in this context, I call differentiated institutionalism. And it's been on my mind for a long time because I found actually from a very early age that people who describe America don't do so successfully if they assume that there is one system that applies across the board. In fact, we are 50 states. We have a federal structure that was defined by the effort to preserve a compromise on slavery. The only way to make sense of American politics is to look at the cities and states and follow an historical institutional analysis that follows trajectories and distinguishes so-called red states from blue states. So you'll be getting a hint of the historical institutional analysis. If you're interested in this, you might look at Donald Herrigel, Herrigel, who writes about a kind of critical institutionalism that is very promising in terms of local experimentation, as well as informed by the rigors and the kind of dark side of the American system. Next slide, please. So this is also in part building on some collaborative work. I have a research volume with Peggy Kahn called The Disunited States of America. And I've worked with Ian Robinson at Michigan and Rosetta Morris at University of Phoenix on some dimensions of a differentiated approach to governance systems in the US. Next slide, please. Well, we know, of course, one more, I think, okay, that's it. We know, of course, that we have still a raging virus in the US. The New York Times very helpfully provides a running list of what's happening. 125,000 dead, 2.5 million have they contracted the virus. The map indicates some of the differentiated experience of the states. We know that some states are doing better, they've flattened the curve, other states are getting worse. And this has significant origins in the federal structure of the US, the way that systems of states govern differently. And I'll be getting to some of those differences. Next slide, please. Now we know that the US is the only developed nation that doesn't have a complete universal health insurance system. We've had various efforts to establish pieces of that, Medicare, Medicaid for the poor, the Affordable Care Act, but we still have a primarily employment-based system. That obviously poses terrible dilemmas when people are losing jobs in the case of the pandemic. People are losing their jobs, employers are shutting down, employers are disinvesting in healthcare, and people are being obviously more and more vulnerable. It's important to know why it is that we don't have universal health insurance in the US. The right wing in the US has been determined to oppose, to obstruct what they perceive to be the greatest danger, a view of a government that actually serves people and proposes and pursues economic redistribution. The Affordable Care Act, which requires employers to offer health insurance, has actually been whittled down already, and also expanded Medicaid for the poor. It made progress in reducing the rate of the uninsured. But even before the pandemic, the rate of uninsured began to jump. In 2018 and 2019, it registered some significant jumps, and now we have employers failing, health insurance programs failing, and obviously people losing health insurance. The gaps in the system, which we wouldn't have to have if we had a complete universal health insurance system, are also only reinforcing vulnerabilities within the minority population. Next, please. Next slide. So we see that 16.2 million workers have probably lost employer-provided health insurance. The numbers are increasing, the system is shaking, and every one of you in the US at least is probably experiencing some of the economic consequences of the virus. In other countries, the burden is not quite so borne by the individual. Next slide, please. And in the middle of all this, in the middle of this ramshackle system that is differentiated by the implementation of the state level and the obstacles to universal healthcare reform on the congressional level, with the Senate not responding to majority will because it has two senators for each state, and the filibuster, which makes it difficult to rule by majority. In the middle of all this, this terrible gauntlet of opposition to healthcare reform, the Trump administration still wants to strike down the Affordable Care Act, which includes protection for pre-existing conditions. In the background, of course, we have to consider that people don't entirely agree as to how the virus spreads. Governments appropriately have considered the evidence to some degree, and there's some debate about what to do, about what level of business shutdown, what level of personal requirement. But it isn't just that, because we don't have good faith actors on the state level or in the federal administration. We have instead states, in a sense, implementing and extending their practices of disregard for the poor as they deal with this virus. What would have made sense would have been a progressive precautionary approach that empowers workers to bargain with employers over safety standards, share the work, and Stephen will talk about that in the context of Germany, provide wage guarantees. We have a patchwork quilt that is of significant value, but many people are left out. It's important to recognize that of the developed nations, probably the US has the most anti-labor policies of the developed nations. Next slide, please. So Congress has acted. This is a list of things that Congress has done. One of the interesting things is that one progressive element of the response was an increase, an additional $600 per week unemployment insurance that is designed to help people get off on their feet. But members of Congress from the South, who are very sensitive to government programs helping people exercise autonomy, were very upset that this would destabilize labor markets. In the 1960s, when the Great Society established Head Start, a program to teach people in school that employed lots of people, the right wing was very concerned that they would lose their domestics with people becoming Home Start instructors. We have a similar phenomenon here. Patchwork quilt, difficult negotiations in Congress, Republicans who deny the virus and resist federal support. Next slide, please. So the administration response is laughable and disturbing. It causes our bodies to shake to think about the elements of this response or lack of response. Before the virus, the administration disbanded Obama's pandemic task force. Trump initially minimized the virus, sought to blame it on China, refused to invoke an act which would permit regulated and sustained production of necessary equipment, the Defense Production Act, invited states to compete for essential commodities. And in fact, the administration seized state orders of ventilators and protective gear. Then Trump endorsed the movement to liberate state governments, rather to lift burdens upon employers and the like, to stop the shutdowns. He wanted to stand with those who were threatening the state legislature in Michigan, telling the governor to stop shutting business down and initiating public protective mechanisms. Trump endorsed an unproven antidote for fun or out of savagery, who knows, opposed wide testing. He helped politicize the Center for Disease Control, which is an advisory body, does not actually issue regulations. 11 million eligible have not yet received the stimulus checks designed to help them sustain themselves. And what is amazing is the Occupational Safety and Health Act administration has been largely inactive. There is not yet a infectious disease standard. OSHA could do this on its own, even before promulgating a complicated standard, but has refused to do so in any significant way. Next slide, please. So the reopen movement, those people calling upon the states to suspend the shutdowns of business, calling upon the states not to require people wear masks, those sorts of initiatives. There are obviously significant numbers of billionaires behind this movement, as well as people on the streets who want to open their businesses again. In the case of Michigan, the Michigan Freedom Fund, supported by the DeVos family, the Secretary of Education, Betsy DeVos, is a member of that family, as well as Eric Prince of Blackwater, a mercenary firm. There are overlapping networks with the American Legislative Exchange Council and other business lobbies. I want to make clear what this kind of network of organizations is, but next slide, please. On the state level, states have significant discretion. The federal government has a limited role. ALEC, the American Legislative Exchange Council, is a business lobby that essentially brings together legislators and business lobbyists and then acts as a parallel legislature, and they pursue a series of policies which end up shifting a blue state in a red direction or a red state in a redder direction. Blue means liberal democratic, red means Republican. In the contemporary context, red shows signs of the old neo-Confederate politics of the South. So ALEC seeks to move the legislature, and in the legislature, they seek to do things like prevent local cities and state and counties from initiating higher minimum wages. They also want the cities not to require more in terms of public safety. They're actually opposing the efforts of local cities to protect their citizens. The red state formula is that if there's an insufficient number of people voting, if voter participation is limited and business is dominant in this process, these states will always end up issuing policies that are not very progressive and not helpful to the working class. So next slide, please. Now, this is just a fragment of some empirical research we've been doing with Ian Robinson and Rosetta Morris. We've been looking at the states and various dimensions of policy and various dimensions of participation. And we find that ALEC membership in the legislature has a great deal of impact upon policy. That is to say, this business lobby is a transmission belt that generates policies that limit workers' rights and also limit cities' responsiveness to the virus and obstruct state action as well. Next slide, please. So as I've said, ALEC is this lobby of business. It works with other elements of the federal structure which overrepresent business oligarchies. The Federalist Society is a party in the courts that is committed to denying the power of government to issue social change. So the Federalist Society has obstructed healthcare reform, and in this case, it's supporting state governments as they seek to limit voter participation and limit state action on the virus. I should mention the practice of voter ID, other forms of voter limitation, even legislatures devised in such a way as to contain majorities. Throughout the system, it is very difficult for a majority of citizens to win their proposals. Next slide, please. This all boils down to something from the very beginning in the Civil War. Despite the First Amendment, the 13th and 15th Amendments, and Article 4, Section 4 of the Constitution, the states are not fully republics. People don't fully have the right to vote. The right to vote and the right to organize are limited by state power, which is controlled by, in many cases, by these historic oligarchs who seek to reproduce Mississippi in the 1950s. There's John L. Lewis fighting for voting rights in the 1960s. Next slide, please. So we have many vulnerable populations who don't get the assistance of active state and federal governments because of the opposition of oligarchies to necessary change. We have meat packers, domestic workers, African Americans, others who are obviously at greater danger, who are dying at this point. Next slide, please. Black immigrant domestic workers are at the epicenter. Next slide, please. We see that among African Americans, many of them know people who have died. It's obviously having disproportionate effects. Next slide, please. Now, we don't have time to go into this in detail yet, but the point is on the state map, you see states behaving differently. Florida, Arizona, Georgia, Texas, Mississippi are all states in which Republican dominance have inhibited action on COVID. Blue states are more aggressive. Next slide, please. You might call this a kind of genocide, not by direct action, but by inaction. Next slide, please. The South is at risk. The young are also at risk there because of the overrepresentation of pre-existing conditions, exposure to toxic chemicals. Next slide, please. Precarious work. We have about a few more seconds left. Next slide. My last point at this stage is to see how the federal structure has required states to organize against the federal government. We have a combination of liberal states forming compacts to fight for coordinated action as the conservative states are fighting for something else that is less productive of the citizens. And we see this expressed in miniature. Next slide, please. Next slide, one more slide, go ahead. Please continue. In miniature, we have a fight between the cities and the state governments in Mississippi in particular, where Fannie Lou Hamer was, the Mississippi Freedom Democratic Party. The city of Jackson has tried to promote public health concerns, but the government has been fighting the city, and it's a battle between races and visions of public policy. That's all for now. I can take a question now, and we can talk more about this in the final experience. No questions? Okay, if there are no questions, wait 1 second, and let's go to Priya. And I'm going to mute myself now. Thank you very much.
Good evening from India. So I'm going to be presenting about India's management of COVID-19. And the very important question that we are asking ourselves now, which is, did we flatten the wrong curve? So where are we now? The last few weeks have seen a rapid increase in the number of people infected with COVID-19, and we now have over 5 lakhs confirmed cases. But what's also good to note is that the active cases and the total recovered numbers are increasing, and our recovery rate is as high as 58%. So the whole process of dealing with the COVID-19 crisis is much more than a crisis of health and containment of the spread of the disease. A lot of it is about the economy and how governments have managed this pandemic and have taken care of people belonging to different strata of society. Let's start with the good part of what has gone right in managing COVID-19. Next slide, please. So even though the coronavirus numbers have continued to climb nearly for 5 months, the recovery rate has been improving by the day to 58% now. This has happened because of extensive testing which is happening, which is increasing every day, and a number of diagnostic laboratories which have been set up by the central government, including about 741 labs in the government sector run by the government, as well as several private laboratories which are helping people to get themselves tested. Now, when you look at where are the numbers, where are the maximum number of infections happening, and which are those containment areas, they mostly are concentrated on 8 states. And this, interestingly, includes 3 of our metro cities, Mumbai, Delhi, and Chennai. These are places which are commercial hubs, places where most of the companies have their headquarters. A lot of people go and stay there, and they are the worst affected. The good part of our containment and treatment strategy has been that there's been several agencies who've been working towards innovative solutions to this problem, including detection and testing kits, creating an low-priced, excellent ventilators, several kinds of disinfectants and hand sanitizers, and all of this. So what happens when you have multiple agencies and research centers and universities working on these multiple innovations? What's most important is to have a body which coordinates all of this action. And that's something which has been happening really well with the special task force for COVID-19 under the leadership of the principal scientific advisor. So they've been able to bring together these multiple stakeholders and connect them to other partners who can take forward their idea and get several of these things into production in a massive scale, and which is what our country really needs. Next slide, please. So the central government strategy of containing the COVID virus has been through a lockdown. On the 24th of March, on Tuesday, a lockdown was announced in the country, and 1.3 billion citizens had to stay at home. Now, what does a lockdown mean? In India, it has meant that you cannot step out, you cannot go to work, cannot go to school or college, no socializing, no going out to buy essential commodities, except in the short duration where you can go and buy your stuff. So all of your daily requirements would have to be ordered on home delivery or get some service to come and deliver it at your location, your apartment or your house. And it has meant 3 weeks within the 4 walls of your house. But this, unfortunately, is a very urban middle class solution, because a big part of India's population does not have access to ordering stuff online or on phone. And there are people who live under perilous conditions, mostly the migrant workers, the daily wage earners who have to work every day to manage and survive for the day, marginal farmers who need to sell their produce on a weekly basis. What really happens to all of them? But the message that we got from our prime minister is that you cannot leave your homes no matter what. So what are the ramifications of an order like this? Though the intentions were really good to curtail the spread of the disease and to ensure social distancing, this is something that wreaked havoc and exacerbated the inequalities that we find in society. Next slide, please. So for the first time, what came to light was that there is a big part of our population who cannot be under lockdown, simply because of the fact that they don't live in permanent houses. They don't have the kind of facilities to gather resources and save resources, which will see them through the 3-week initial lockdown period. They need to work to earn their daily bread and may not have the reserves to see them through these 3 weeks. 90% of our population works in this unorganized sector where there is no legal protection and there is no safety net for them to fall back on once they are locked within their homes. And this includes construction workers and domestic workers, textile workers, brickyard workers, and things. So it's a huge chunk of our population. But then why were they not thought about when we introduced the lockdown? Because they've largely been invisible. And nobody thought about the ramifications of this very sudden and abrupt lockdown on people who did not have that safety net. So it has increased the inequalities and the difficulties which are disproportionately high for this group of people. Next slide, please. So what did they do? Most of these people are working and living close to their place of work. So it could be a construction site, it could be a place where they have a temporary employment. So they live in makeshift houses. Now, once the lockdown started, there was no economic activity. It all came to a grinding halt with one speech at the night. And from next day onwards, everything is shut. Now, what do you do in such a situation? When you're running out of money, you have no food. You cannot survive for 3 weeks. So the lockdown left them unemployed and hungry abruptly, overnight. And with the lockdown, all public transport stopped, the buses, the trains, everything stopped. So many of these people decided to do the unthinkable. They decided to walk home from the places where they worked in, which was not a state they belonged to, back to their hometowns, to states like Uttar Pradesh and Bihar and Jharkhand, all of those. And the only option for them was to walk back home. And one of the questions that one construction worker asked was, they come to metro cities to build houses, build huge commercial complexes, to build offices. And if we spend our lifetime and our energies building these, why are we not allowed to go back to our homes so that we can sit through this pandemic? But there was simply no way for them to go home. So what they did was, they said that they decided to walk back home, walk back. And we're talking about over 1,000 kilometers of distance. And to think of people walking back home with their meager possessions and children is a heart-wrenching story. Which brings back to our mind the question, why was this not thought about by the administration before you had a lockdown? Next slide, please. So, by the 1st of May, government decided this was a catastrophe. There were people dying on the road because they were walking hungry and thirsty without food. So on the 1st of May, they started something called Shramik trains, about 250 trains from different parts of the country so that the laborers could get into the train and get back to their villages. But this was really too little, too late, because there were already people dying on the road and there was an exodus on the road trying to walk and get back home. So who helped them? Civic society stepped in at that point in time, and individuals paid for people to get back home. They arranged for transport, they arranged for vans and buses which would take these people back home. Now what this has done is, it has really been a wake-up call for the government and industry to look at better living conditions for people, because this cannot be the norm. And this is one instance where we are facing this reality face to face, that these kind of inequities is absolutely unjust in this day and age. Next slide, please. Now, what this requires is, we need to really reboot and rebuild our state so that people don't all move to towns and cities in search of employment. So what can you do in the rural areas to improve their employment opportunities there? So one way would be to increase the number of producer cooperatives, to have social entrepreneurship in villages, and really build the village economy so that people in large numbers don't have to go to cities where their facilities and their living conditions are abysmal. And when there is a problem like this, they're actually left with absolutely no safety net. Next slide, please. Can I have the next slide? And this is in stark contrast to how the expatriates were treated. So when the lockdown happened, a lot of expatriates wanted to come back to India. And for that, the government started the Vande Bharat mission. You had a whole fleet of Air India flights, about 423 inbound flights, and the numbers went on increasing every week to get people in. So when you look at people who are working outside, earning well, there's a lot of emphasis on bringing them back, and a lot of planning which went into getting them back to their home countries. But this was completely missing when it came to the laborers, and that's why I call them the invisible people. Next slide, please. The economic impact has been completely devastating because we've had the lowest industrial output, the lowest growth rate of 4.7%, and a huge job crisis, both in the formal as well as in the agricultural and the non-agricultural sector. So the small scale industries and the medium enterprises have been very, very badly hit because of the lockdown. Next slide, please. Can I have the next slide? So the government introduced these economic packages, revival packages in tranches. But when you look at the nature of revival package, it's more of an economic reform rather than a package. It does not bring immediate relief to people, but only tries to give long-term benefit in the form of loans and credit cards and things like that. So there's no immediate benefit for those who are really affected by the lockdown through these measures. Next slide, please. Now, we come to a contrast, my state, Kerala, in dealing with COVID-19. Now, Kerala had an attack of the Nipah virus in 2018, and that's been really helpful in understanding what kind of protocols to put in place very quickly. And that has really given us a head start in managing the COVID-19 situation. In fact, here in Kerala, the whole approach has been a very decentralized, people-centered system with a lot of local autonomy, and that has helped a lot in ensuring that cases are traced, people are quarantined, and there's treatment being given. And of course, Kerala has a public health system, which is infrastructure, which is much better than most states in India. So we've been able to tide over this crisis quite easily. Next slide, please. Now, what Kerala government did was, under the able leadership of our health minister, we started the Break the Chain campaign. And this started as early as the 14th of March, where people were told about the need for washing their hands and maintaining social distance. So a lot of these messages were popularized and spread, so people understood what is to be done. And they used a lot of local self-government as well as teachers and Kudumbashree workers to reach out to people and identify who are the ones who are susceptible to this, and quarantine them and take care of them. So symptomatic cases were quickly moved to isolation facilities, so you're able to contain the spread of the disease. Next one. Next slide, please. With respect to the guest workers, now Kerala also has a large number of migrants who come from other states and work in Kerala. But the treatment of these people by the Kerala government has been exceptional. Most of them have been given very good facilities to stay. Their food and requirements have been taken care of. All their basic needs have been taken care of, and several of them who wanted to go back home were put in trains and sent back home. So the government also has a rapid response team which saw to it that these people are really well taken care of. So that's very different from the clueless method of dealing with this crisis by the central government. Kerala has done exceptionally well there as well. Next slide, please. The other example which we really want to look at, can I have the next slide? Is in terms of the expatriates. So Kerala's biggest exports is a skilled manpower. They're working all over the world, and the biggest number happens to be in the Gulf countries. So many of these people wanted to come back to Kerala because the health facilities are really good here and they can come back to family. So this has been a dilemma for the government. Do you let them in because they would bring in infections and increase the number of COVID cases in Kerala? So Kerala has given its own recommendations of guidelines to the central government, which the central government disallowed and called it impractical. But ultimately they had to, because they wanted a COVID negative certificate from people before they come into the state, so that they don't increase the number of, the spread of the disease in the state. But finally, government had to settle for the PPE equipment. The people should be wearing this. And they had to give up their request for a COVID-19 negative certificate. Next slide, please. And the last one has been the digital divide. The digital divide has been made so obvious with this lockdown, because once the lockdown started, the education entirely moved to online. And then that was the time when people realized that there are a good number of a good percentage of our population who does not have access to smartphones and laptops, and where the internet has not reached. So how do you involve them, and how do you ensure that they too get the education? This has been a huge crisis, and the switch to online education has been, again, very, very abrupt and completely ill-prepared for a country like ours. So this, of course, is also an opportunity, because in a state like Kerala, the government's attempt is now to improve the reach of technology and ensure digital access to as many as possible. So they're using this opportunity to ensure that every child has access to some kind of a digital technology so that they can attend online classes. But what the COVID-19 situation on the whole has done in our country is that it has accentuated and brought to the front the basic inequities in the system, which was somehow shoved under the carpet until now, but now has to be dealt with, including reducing digital divide if we are to continue with this lockdown and life goes on. I'll be happy to take questions on any of the things which I have discussed.
Any questions for Priya? Well, we can hold that till the end, unless anything else pops up. So let's go on to Sean. Thank you very much.
Okay. Thank you very much. So I've called my presentation "Flattening the Inequality Curve" because South Africa is always appears in the list of the most or one of the most unequal countries in the world. And what the pandemic has done for us is really amplify many of those inequalities. So I'll start off the presentation by just giving you some context and background to South Africa so that you can better understand the context of the pandemic. Next slide, please. So our population is about 58 million. It's a relatively young population with 60% of the population being between 15 and 65 years old. And I'll come back to why that is important later. Poverty levels are extremely high. Unemployment before the pandemic was close to 30%. So at the moment, it's even more than that. And youth unemployment is in excess of 50%. We're still experiencing high numbers of HIV and TB infections. And I think the latest sort of figure is at 7.9, almost 8 million people are living with HIV. And a quarter of a million South Africans living with TB in South Africa. In my own province of KwaZulu-Natal, the HIV rates are estimated to be sort of 1 in 4 people in the province is HIV positive, and TB rates are equally high. So that immediately was quite problematic with the virus, because these are really vulnerable groups health-wise. And there were many concerns about an overburdened healthcare system, and predictions were made about a complete sort of apocalypse, right, in the country, with people literally, sort of collapsing in the streets and so on. But as we'll see, that hasn't really happened. Next slide, please. So these are the figures as of the 25th of June, and they haven't changed significantly as of today. So on the 25th, there were 118,000 confirmed cases. The recovery rate is just over 50%, and the fatality rate is just under 2%. And we've had about 2,300 deaths so far. Next slide, please. Sorry, can you go to one before? So we'll see that the number of critical cases treated in our ICUs is 539. And the average sort of daily confirmed cases is about 2,000. The next slide, please. So this graph shows the sort of strategy that the state adopted. So the first confirmed case in the country was on the 5th of March, and that was a South African who had returned from Italy. He was on holiday, and he was tested positive on the 5th, and then the country enters a state of disaster on the 15th of March, and our national lockdown, which was very similar to India's actually in terms of strictness, officially began on the 27th of March and lasted for about 5 weeks. So these sort of 8 stages that are represented in this graph show the sort of the strategy that the South African state adopted, from preparation, primary preparation, implementing a strict lockdown, active case finding, identification of hotspots, medical care, death and bereavement, and currently with the state of vigilance. And then you can see that initial strict lockdown reduce when it was implemented, it helped reduce the number of new infections. And what it did was buy the country a considerable amount of time to try and get logistics in place, because the country couldn't perpetually be in lockdown. Next slide, please. Here is just a list of the case data as of the 25th of June. And I think what's interesting to note here is that, so this is a list of the South African provinces. And what's interesting to note is that almost half our cases are located in the Western Cape. And that's interesting because the Western Cape and the capital is Cape Town is the most sort of touristed city in the country, and we suspect what happened there is that tourist season continues right up until March, that many tourists from around the world may have unwittingly spread the infection. So whilst the first case was recorded in KwaZulu-Natal in March, we suspect that the infections began in the Western Cape much earlier. So the bulk of cases are appearing in the Western Cape, and they are definitely going to peak before the rest of the country does. The next slide, please. So here you can also see the number of deaths per province, and the largest number of deaths occur in the Western Cape. The next slide, please. So in terms of our testing, it's more or less an even split between the private and public sector. To date, we've done, so as of today, about 1.6 million tests have been done. And it's a partnership between the state sector and the private sector labs. Next slide, please. So the initial puzzle with the South African case is that it has not followed the sort of predicted path. So we really expected, with our high levels of HIV and TB and sort of under-resourced healthcare systems, that the fatality rates and the infection rates would be much higher. And also, given our inequalities, which the pandemic has definitely amplified, that was also further concerned us further, the high rates of poverty. It was interesting that when the first cases were tested in the country, it was viewed as a sort of white person's or rich person's disease due to the nature of those initial cases. So the initial cases that would, the initial people that were tested positive were all South Africans that had traveled either on holiday or on business. And it took quite a while before the first community transmission cases took place. Next slide, please. So whilst we have no way of predicting what's going to happen next, cases are rising, and fatality rates, mortality rates will go up. We can sort of make certain assumptions about the trends. I think the one is that it was a very early response. The early lockdown and the strictness of the lockdown definitely bought the country time. It was a cohesive state policy with opposition parties, the ruling party, all being in agreement and showing solidarity. That solidarity has since fractured as time has gone by, but certainly in the first 5 weeks, it was there. It was very much a science-led initiative, and I think that's important to say, because with the HIV epidemics that the country experienced, there were many unscientific sort of assumptions made about HIV, whether it's really a virus, how to treat it, does it even exist, which I think South Africa has learned from, and has, so that's why I put science-led there. I think experience with TB and HIV epidemics also laid a lot of the groundwork with sort of community health workers, the logistics of having to deal with this, and so on. We also have a very young population, as I've said, and so that may also account for lower death rates. Perhaps we're not as globally connected as countries in Europe or the US. The Western Cape, and specifically Cape Town, is an anomaly, and we can discuss that later. Next slide, please. What we are seeing in the Western Cape, though, and I think this will start materializing elsewhere, are racialized patterns of apartheid geography. So nearly 12% of all infections in the Western Cape are in Khayelitsha, which is the largest Black African township in Cape Town, even though it only has just 6% of the province's population. Mitchell's Plain, which has a large mixed race, or what we refer to as colored in South Africa, population has a 9% infection rate. Whereas Stellenbosch, which is primarily white and a university town that caters mainly to sort of white Afrikaans students, has just a 1% infection rate, even though it has 4% of its population. Next slide, please. So we can talk about this during the discussion, but it was interesting that in the largest poll done on the pandemic in South Africa, that 78% of South Africans said that they're willing to sacrifice some of their human rights if it helps to control the spread of the virus. So the good of the collective is seen as primary. Next slide, please. I'd like to speak for a minute on higher education, because I think what it's done, as Priya suggested as well in her presentation, is that it has amplified issues of inequality and access. So it's amplified the sort of racial and class disparities around access to higher education. And given our very young population, this is a large percentage of the South African population. And in many ways, it's sort of accelerated calls for decoloniality and higher education in South Africa. So this would be around issues of access, assessment, what is a university, and it's, so this has sort of been an unintended consequence, where the Fees Must Fall movement, for example, in 2016, sort of began a debate around this, and these issues of inequality and access to higher education have definitely been amplified. Next slide, please. So what about the future? So similar to, I think, Priya's presentation, the economic fallout has been staggering. The country now may look to the IMF and the World Bank for loans, which comes with its own sets of issues. The peak outside the Western Cape is still approaching, so we can't predict what's going to happen there. But it's raising a number of issues around universal basic income grant. What does it mean to be a citizen? How do we deal with some of these amplifications of inequality? And what the country has done right as well. So that's my brief presentation, and I'm happy to take any questions in the discussion that will follow. Thank you.
Any questions for Sean? Let's see anything in the chat. If not, we will continue to the last presentation. Am I correct, Steve?
Yep.
Okay, it's your turn.
Okay. So while I'm waiting for my slides to come up, one thing that I think is worth noting with all the presentations is that all of the countries that we're looking at are federal, and even, you know, in recent years, the UK with the four nations has a federal structure to some extent as well. So it's interesting looking at how federal countries deal with this. And this would be a question that I'll just put out there. I won't expect you to answer it, David, right away, but it's something just to put out there, is if the United States weren't federal, you're very critical of federalism, I think with justification. But if the United States had only been dependent on the federal government, the Trump administration, to deal with COVID-19, I would suggest we may have been in a worse place than we've ended up with federalism that's allowed some regions, the West Coast and Northeast, to deal with the issue better. So my presentation, the one big difference between this and the other one is I'm comparing two countries, and Germany and the UK. And I've titled it Dealing with the Cards You've Dealt. And the underlying theme is that policy choice and policy execution matter. Next slide, please. So when the outbreak began in Europe in late January, the health ministers in both Germany and the UK assured their publics that they had everything well in hand and that the problem would not become big. As we know, that wishful expression did not come to pass. Next slide, please. Now, this slide really shows the difference between the trajectories in Germany and in the UK. And it's very instructive. In fact, a group of economists at Oxford just released a study today where they tried to bring the data for COVID on apples to apples. And it lines up pretty much with these data here. The one looks at the number of cases per 100,000 citizens and compares Germany and the UK. There are twice as many cases per 100,000 citizens in the UK, and even more disturbing, there were 6 times as many deaths per 100,000 cases in the UK than in Germany. Next slide, please. We can also see how this is played out on the economy, that the impact on the economy of COVID-19 has been much sharper in the UK than it has been in Germany. And just the number of cases is part of the story, but there are other issues as well, which I'll get to. Next slide. So I'm going to talk a bit about both countries, and I think you can summarize the German response to keep it simple and coordinate. And to pick up on something that Sean said, which I think was crucial in the German case, is when you have a head of government, Chancellor Angela Merkel, who is a trained chemist, that science really played the forefront role in figuring out how to proceed with dealing with the crisis. So one of the things that the German government did was very quickly develop a very simple test and got it up and running very quickly. And that was very helpful in identifying where COVID-19 was quicker than most other countries. Next slide, please. In Germany is a case actually where federalism has worked reasonably well. I think it might be important in this instance to distinguish that all federalism is not the same. That there's people talk about federalism in 2 grand types. One is called layer cake federalism, where you have similar entities independent from each other reproduced as far as government agencies at state and national levels. The US has that. Germany has something that's called more marble cake federalism, and that is that there's a mixture of competencies, and it's more of a division of labor in terms of competencies instead of a reproduction at different levels. And also, you can even look just to the German upper house, the Bundesrat, that it is actually the governors of the states who are the representatives in the upper house. And so there's already a great deal of experience with coordination and working together. And as a result, the German states were able to work out fairly quickly a coordinated response. They avoided some of the issues that happened in other federal systems, like they centralized buying personal protective equipment and other things like ventilators, and they were able to work out federalism in a very effective way. Next slide. Now, you had also planning with some clear targets. The targets are very familiar from country to country, so I won't really stress them, except the ideas are to flatten the curve, to make sure the hospitals don't get overwhelmed, and to provide accurate information. Next slide. And eventually, Germany did go to a lockdown like most other places. Something that Germany also did reasonably well was they began a test and trace system early. And instead of trying to rely on developing world-beating apps or high tech, they went to the old-fashioned, just people with notebooks going around and talking when individuals have gotten COVID-19 to find out their contacts and keeping track of them. And it's worth noting the number of tracers, because there are many more tracers and offices in Germany than in the UK. Another thing that the Germans did well, and this runs counter to type, is that the Germans really decided to expand fiscal measures, including short-time work, which the British referred to as furloughs, and fiscal stimulus in a number of areas to try to keep the economy afloat. That's one of the reasons why the German economy thus far has performed better. Next slide. Now, eventually, Germany went to deeper social distancing, and like all other countries, it has pulled out and has begun partial reopening. Next slide. That one of the things that reopening continued in May, and there has been a federal structure to it, allowing the individual German states to decide when to reopen. Now, Germany certainly has not been perfect. That one of the things that COVID-19 has revealed, like in many other countries, is inequalities and exploitations. And the stories which some of you may have seen of the outbreak at the meat packing factory in Gütersloh has been an example of how relying on subcontractors and subcontractors for the labor force and really substandard health conditions can lead to flare-ups when they are just allowed to run up unchecked. Similarly, there's a 2-day strike going on in Germany at Amazon locations, protesting inadequate conditions for protecting employees. Next slide, please. Moving to the UK, this quote, "A bad hand played badly," some of you may recognize it from The Economist leader this week, looking at the British economy. And I think the British government has not done a very good job in dealing with COVID-19. That the first approach, which some of you may remember, was this notion of herd immunity, and it was this concept of not doing a lockdown at all and allowing the disease to spread through the general population while trying to protect the more vulnerable and keeping the health service functioning. It did not work well. Some of the arguments in favor of it were if Britain locked down too soon, that there would be lockdown fatigue and you wouldn't have lockdown when you needed it. However, Niall Ferguson of Imperial College London recently did a study where his estimate was that if Britain had locked down a week earlier, 20,000 lives, or a little less than half of the deaths that official deaths that Britain has experienced, would not have happened. So it shows how much a difference a week can make. Next slide. One other thing that came out very clearly is that the Public Health England was overwhelmed. And when one looks at the UK case, Britain tends to perform the worst compared to the other 3 nations. And Britain had trouble, Public Health England had trouble getting personal protective equipment, was slow to test, had some testing failures, and had inadequate tracing. And so there was a lot of breakdown. Some of this is reminiscent of what we saw in the United States. Next slide. But eventually on March 23rd, the UK came down with a fairly rigorous lockdown. The slogan was "Stay home," very clear. And it was something that was similar to a lot of the lockdowns that we saw in India and South Africa, not quite as strict, but a stricter lockdown than in the United States. The lockdown was comparably strict to what happened in Germany. One of the things that I think the British government did right was the furlough pay system to try to give people purchasing power. and you know, that was an important and positive step that the British government did. The big question for all governments in the more affluent world where they can afford these furlough payments is how long can they keep them up, and what happens if they let them go on the one hand. On the other hand, how to deal with the debt once this crisis is over if they keep them going. Next slide. You know, Britain has the case of Boris Johnson becoming ill. It really affected things greatly. There was a lot of sympathy for Prime Minister Johnson, and it did put in some question on to how seriously the government was taking it beforehand, but it certainly was a wake-up call for many within the British government when Boris Johnson fell seriously ill. Next slide. There certainly had been a lot of hypocrisy within the highest levels of British government. There was a big scandal involving the Prime Minister's chief advisor, Dominic Cummings, who broke many of the lockdown rules. And however, his prime minister more or less said that he respected the spirit of those rules. It's fairly debatable whether that was the case, but this issue of hypocrisy coming from the highest levels certainly is familiar to people on this side of the Atlantic. Next slide. And then Britain trying to phase out. We had an intermediate phase that began on May 11th. In England, at least, the slogan was "Stay alert," and nobody quite knew what that meant. So it was a bit of a problematic slogan. There was also a push to do school reopenings, particularly at the elementary level. The idea was to help, in particular, people get back to work by having their children go to school. That also was not handled well. And we're moving into, for the UK, stage 3 for England. And the Prime Minister said earlier this week that the great hibernation would be over, and change the rules on social distancing from 2 meters to 1 meter plus, which again, you get into this question of hazy decisions which seem to have more politics and concern about the economy behind them than science. But Britain is going to try to do a reopening beginning on July 4th. We also had some efforts that weren't completely successful with bringing in contact tracing. The Johnson government tried to do more of a moonshot approach of we're going to have a world-beating app. When the world-beating app proved inadequate, that there's been a fallback to develop an app based on what Google and Microsoft have been working on, and we'll see where things go from there for Britain. Next slide. So again, back to the theme that performance does matter and populations notice it. You can see the red line is the confidence of the job that the governments are doing by the various populations. And Britain started in early March up high, but as these various mistakes happened, the British government has slid. The German government had a bit of skepticism about it at first, but as its progress has worked, that the population has maintained a relatively high confidence is what is going on. So for a seminar on management, I thought it was important to point out that good management at the political level can be rewarded with public support, and bad management, at least in this case, in most of the countries that have had bad management, has been punished. Thank you. David, you're on mute.
Thank you. The message said unmute your microphone. There was an enormous amount of national detail, and I really appreciate that. All of you did a great job in focusing on describing the situation in your countries. And now there are a few questions. There were 2 questions from Alex, 1 question to me. And let me just talk about the question that was asked of me, and then Priya has a question, and then I'll ask a question to the group if that's appropriate. So the first question that Alex asked me, one of the many Alexes here, was how has the debate in the US influenced the debate in other countries? And it seems to me that one factor that is common across the countries is that there are, in fact, very active global networks of billionaires who build think tanks and attempt to distribute their ideas. And I've been talking about various organizations in the US that get funding from the Koch brothers and others in the US. And they also link to the Mont Pelerin Foundation. So I think you'll find in England, the Institute of Economic Affairs, and you'll find in many other countries, think tanks which advance a libertarian perspective, which would in this case focus more upon how it is the business should have its interests reflected and that protection for ordinary people should be minimized. So you see that within the debate, maybe in a minimal way in the UK, but I believe Kaiser Permanente has been knocking on the door asking to take over the National Health Service. So some efforts to push ideas from the US to England. Maybe the most notable extension or coincidence of US and foreign ideas is what's happening in Brazil. It would seem to me that in Brazil, the libertarian think tanks have had a great deal of influence on Bolsonaro, and that seems to have resulted in similar policies of ignoring the facts and letting things happen. And then Alex had a question for Priya. Let me see. The question is, if I am to restate it, what could India have done better? Is that the question from we have in the pipeline? Priya, you had the question before, so you can restate in audio your perspective.
What would the central government have done better? I think the biggest problem has been in the abruptness of the lockdown, with absolutely no warning to people. So it was, I think, in a way, ill thought out and badly planned, because they never understood what would happen to several people who are working in different cities if you close down transportation. And when there is no way of earning a livelihood, because these are people who don't have social security, they have no social support, there's no safety net. And this is a huge part of our population. It's not a small number that you're talking about. So the humanitarian crisis has been worse than the pandemic itself. So that planning was not there. Now, this is in contrast with the Kerala state where the approach has been participatory and people-centric. And that's been a major advantage, and that has really helped the government manage the situation much better when compared to several other states.
Thank you, Priya. Before we, let's see, we have questions about the UK for Stephen. One is the public sector bodies hiring management companies to operationalize healthcare responses. This has been observed as exploitation of a shifting Overton window. Is it a good policy decision? Will it have longer term consequences? Steve?
So can you say it again?
It's also in your chat.
I was looking.
The UK government granted emergency procurement powers to public sector bodies during COVID-19 and hired management companies to operationalize healthcare responses. This has been observed as an exploitation of a shifting Overton window. Is this a good policy decision? Will it have longer term consequences?
Yeah, I don't think it was a very good policy decision. That the thing that it did is it ended up sacrificing a lot of oversight, and it also made it difficult for coordination, particularly among the four nations of the UK.
Thank you. One more question about the UK from Framya, and that is, was the problem of the UK due to leadership inadequacies or a deliberate attempt to prioritize the economy that went wrong?
That's a very good question. I think that there was certainly a bit of both that was involved. That the UK was hit very hard. And one of the reasons is because the UK is a heavily service sector economy, more so than others. But to circle back a bit, I think a lot of the decision to delay the lockdown had a lot to do with trying to preserve the economy. So I would put it ultimately, in looking at the UK, I would put the blame on an effort to, that in the end backfired, to try to keep the economy going when not locking down actually made it worse.
Thank you. And Arturo has a question for any panelist. Can you elaborate on the difference the pandemic solutions or economic focus versus social focus? And we've all been alluding to that. What is the best balance of the two? Is there a solution, a kind of reconciliation of the factors? How about Sean?
So initially, I think for the sort of first 5 weeks of the lockdown, the economic issue was sort of peripheral almost, right? It was about saving lives and so on. But during that period, a number of organizations, sort of more sort of right-wing, some neoliberal ones, actually started organizing and making the case for the economy to open. So now the economy, every day, new sectors of the economy open, and we've yet to see the consequences of that. So I think we have a state currently that's really in a difficult position. You know, on the one hand, it's a fine balancing act, and unfortunately, I don't know what the solution is, but what we can see in the Western Cape, which has a different provincial government from the rest of the country, is that they are far more, they've opened the economy up far more widely than the rest of the country, but also their compliance levels have been less. So we are therefore seeing as a consequence much larger rates of infection. I mean, almost 50 or more than 50% of the country's infection.
You know, one thing to say to that question, it's interesting, it may be more of a rich country's luxury on looking at how they've handled income replacement. That when you go to countries like Germany and Britain, they both used furlough, which is a system which works well if you already have a job and replaces either all or part of your income in an existing job. The one thing that did not cover is more of the gig economy, the informal economy employees. And in fact, when you look at the United States actually did some things that were favorable to the gig economy population by allowing them to apply for unemployment. But that said, I think David's point about people going on unemployment, losing their health insurance is a big blow. I think ultimately a lesson that comes out of this for countries that can afford it is to take a serious look at universal basic income as a way to provide a floor for individuals in emergencies like this when they arise.
Yeah, and can I just say that that was one of the initiatives implemented by the state, a sort of basic income grant for the period of the pandemic on a monthly basis. It's not a large amount. But what was interesting is that this has been a debate in the country for so long, and within the space of 3 to 5 weeks, it became a policy. But also in the case of South Africa, unemployment rates were like, pre-pandemic, the country was already on the brink of, of economic stagnation, high unemployment. So now suddenly dealing with this crisis, it is a crisis, but it doesn't feel, it's something we in daily crisis in South Africa. So it doesn't feel like something completely different in many ways.
Thank you. Sapna also has asked for all the PowerPoints, and I'm sure we can make sure she gets them. And then Arturo has a follow-up question. Was the economy reopening a narrative of wealth accumulation by corporations or a narrative of economic need to survive by workers? And let me say something about that. I think in the US context, there was definitely an ideological movement to return us to the status quo a set of practices in terms of labor and social protections, which was minimal. And their organizations were very active in the red states in promulgating this narrative. It isn't that it wasn't a reasonable concern to get people back to work, but the question is, can we get people back to work in a way that involves participation and labor standards rather than mere capitulation to current conditions? Any other points on that from anyone else in the group? About the ideology and the
Well,
narrative?
I mean, one thing on ideology in the United States that's happened is in a lot of the red states that the governor's priority has been trying to get lawsuit protections for the companies so that their employees cannot sue them if they get COVID-19 on the job, rather than dealing with the concerns of the employees.
Right, that rather than OSHA standards, safety and health standards.
Yeah.
And then FNYAME00 asks David and Sean, if we compare the US and Nigeria, we can see the situation in the US is far more serious than Nigeria. What are the nuances here? Any thoughts about the US's clear role as a dysfunctional state in this context?
Well, I can't really comment on Nigeria, but so I can just tell you how the sort of US response is sort of being perceived in a South African context. And it comes across as a completely sort of incoherent, unprepared, it's basically a disaster, right? And I think it's in the initial sort of phases of our sort of response, the South African state was, well, we're not going to be like the US. And it was almost a point of sort of national pride to sort of have a more cohesive strategy. What I do know is that I mean, Africa is a large continent, and the sort of responses from different African countries has been highly variable. But we do in South Africa have the highest infection rates because I think we have the infrastructure to do more testing and so on. So that's all I can say on that.
Thank you. Was Alex Bristow about to answer this question as well, or am I misunderstanding the cue here? Alex Bristow? Were you to ask or answer the question? Anyway, in case I'm misunderstanding, there's a question from Ozan for all the panelists, which is, we were told that regionalization was one of the main triggers of globalization. Given the current situation of the EU, NAFTA, Commonwealth, etc., do you expect to see more integration or more disintegration? Ooh, there's a big one. Who wants to venture to answer that question? Priya, do you want to try?
No, I think I'll pass the question.
Okay, well, this is—
The only thing that I would say is certainly within both the UK and the United States is you've seen states trying to, that do see their management being better of the crisis, trying to get that autonomy to preserve what they've accomplished. And certainly we saw that with Scotland in the United Kingdom, which has had a better performance than England. And I would also say that within the European Union, the different states that have done better have tried to isolate themselves from the states that have not, closing borders, etc. So I think this crisis, at least in the short run, has produced more disintegration than integration. Now, whether there'll be a turn on this eventually, when there can be more of a coherent national approach, who knows? But at least in the short run, the crisis has produced disintegration rather than integration in most places.
Thank you, Stephen. I suspect, though, we will see a little bit more developing in terms of the compacts of liberal states in the US and their coordination with countries around the world. We have a lot of reconfiguring going on of political systems and coalitions of states. You might find New England coming up with ways to collaborate with Europe on some of these issues. I think there are no open questions, and it is now 3:23. If anyone else wants to make a comment on either federalism and ideology as it relates to individual countries' behavior on these questions, that might be interesting. Any last thoughts on that?
Yeah, David, I'd like to come in here. One of the trends that we notice now, particularly with this, the migrant crisis, which we've experienced with their inability to go back to their homes. Most of their home states have decided to set up industries and boost village economies so that people don't have to move to other states in search of employment. Now, this has always been there on the cards, but I think with the COVID-19 pandemic, the boost or the effort to get more localized in terms of industrialization has really gained momentum. And we would see that. We would see more of social entrepreneurship happening in villages, a lot more decluttering of the big cities happening. And that is going to be a big move because people don't want to go anymore to the big cities and work there, because the moment there's a crisis, they know what they would be experiencing and how they would be without any help. So I don't see people going back in large numbers back to cities. So states will they have already taken the responsibility of ensuring that they have enough employment opportunities so that people don't have to go to the big cities. So that will happen over the course of a few years. And I think that will be good for the country.
Thank you very much.
One thing that I would add, thinking about it from an economic perspective, is this crisis is feeding into things that already had begun in terms of countries thinking about resilient, or businesses thinking about resilience, shortening supply chains, not really stressing low cost, but stressing reliability of supply. And I think that will be a long run economic consequence out of this crisis. There'll be a bit of an unwinding of globalization in favor of resilience.
That would be great. Actually, there was a question from one of the Alexes, which is about behavioral design methods like sidewalk widening, grocery lanes, and the like, to passively encourage the right behavior. In comparing countries, can you speak to the effective differences in being more forceful or more libertarian in enforcing social behavior, distancing, quarantine? Any thoughts about that?
So we have moved from sort of a strict lockdown where it was sort of, quite forceful, to now the state encouraging and workplaces encouraging more behavioral changes. Some of it is around spatial design. So, staggering the times you arrive to work, changing the physical structures of buildings and offices. So a lot of that is happening, at supermarkets, and outdoor spaces, schools, and so on. So I think it's not an either or situation, but I think going forward, it's definitely going to focus more on behavioral changes and nudging them in that direction. And people are generally quite compliant in that regard.
Thank you. And Priya, you were about to say?
Yeah, so in India, companies have decided to have just about 33% of their employees coming to office. The rest will work from home. So that's one measure which will help maintain social distancing and keep the spread of the disease under control. The second thing, particularly with reference to my state, Kerala, is that campaigns and public education is extremely important here. And that's something which has always been happening in our state. Tell people about how to maintain social distance and how to keep themselves hygienic and how to wash hands repeatedly. So that communication messaging is very, very important. And states who've done it well have seen people complying because people understand this and they know how to do it. And most importantly, they have the resources to do it. So if you don't have running water and you don't have access to public taps, then how do you wash your hands? If hand sanitizers are out of supply, what's the point in talking about hygiene when you don't have the basic resources? So offering basic resources and education have really gone a long way in helping people keep down infections.
Thank you. It's certainly clear that this crisis is motivating people to rethink the role for universal basic income and social protections. In the US context, it's kind of a perfect storm. That is to say, a combination of the police protests and the pandemic crisis, there's some increasing understanding of the role of race in the US context. And there is one member of Congress, mine, who was hoping for the third Reconstruction, which would mean maybe an effort to address the neo-Confederate infrastructure that has obstructed social change in so many respects. Are there any final questions in the last 2 minutes? I think there are no open questions. So I want to thank you for participating, the panelists, Stephen, Priya, and Sean, and Kat, and Mari, and all the incredible staff of CMS organizers. So I really appreciated doing this with all of you. And I posted my PowerPoint. I'm sure we will get the other PowerPoints out to people who are interested. Any final business to conduct?
Lovely. That's great. Thanks so much, David. So yeah, that's to say, to conclude this webinar, I'd like to say thanks to David, to Priya, to Sean.
I can't hear you, Kat.
Oh, can you not hear me? Can you hear me now?
Not very well. Maybe it's my system. Anyway.
Here, can you hear me better now? Yeah, there we go. Okay, so yeah, so just to say that concludes our webinar for this morning, this afternoon, or this evening, or even night, where if you are in somewhere like Priya's. Thanks so much for joining us, Priya. So thank you to David, to Priya, to Sean, and to Stephen. We will be posting the video on AOM Connect, but in the meantime, I'd just like to say thank you to you. Thanks for tuning in, and also that you should be able to listen into our next webinar, which is on July the 6th from 10:30 till 12:30 EDT. If you want to register for that, you can go to the Eventbrite CMS In Touch webpage. And likewise, if you're interested in actually hosting one of the webinars, like David and his colleagues have, just get in touch with us at cmswebinars@gmail.com. But in the meantime, I'd just like to say thanks very much, and goodbye from David and his panel, and goodbye from the CMS In Touch webinar team. Okay, we should be all fine to talk now. So that's everyone cleared except for Ozan, who's one of the organisers.
Stop the recording, Kat.
Yep, I'll just stop it now.